Good evening, everyone. Thank you all for coming tonight, and we're a lighter crowd than I thought, but I know we'll have a lot of good questions and a good discussion, so we'll just get started on this. And this is a continuation of the discussion that we started during the health fair that was held over at the Armory on the 21st of October. And Deanna was going around talking to people, and the conversation was sort of interesting, and everybody was sort of saying, well, what did she find out from everybody else? What's going on? So, my name is Carolyn White, and I'm the president of League of Women Voters here at Park Rapids. League is a national organization that was formed 106 years ago. And we are a 501(c) nonpartisan organization. We do not support or oppose any candidates or political parties at any governmental level. But we work on vital issues of concern to the members and to the public. The League encourages informed, active participation in all government and politics. Before I go ahead and introduce the panel, we've got some housekeeping details. For those of you, for anybody that's too new, if you need to go use the bathroom, out that door, up to the end of the hallway back there. And let's see. And you might want to turn off your phones or mute them, because this program is being recorded. And so if it goes off or anything like that, you will be on the YouTube channel. And especially if you're sitting over in that area, you're going to have to be a little bit more quiet or careful about what you're saying, because you're really close to the mic.
Is it live?
It's live now.
Oh, it is now.
Oh, no, I don't know how to do the live streaming. Shannon does that for us once in a while. We just put it on video, and I upload it on the YouTube channel, and anybody that wants to see that video or something, leave me your email address, and I'll send you the link. And that. Okay. And right now, we are taking a collection for the food shelf, so I'm going to hand this to Brian, and he's going to tell you a little bit.
Well, I just want to thank you for the donations and things like that. Usage at the food shelf is up quite a bit right now with everything going on. I would say long-term, the big beautiful bill is reducing SNAP, so we're going to see the effect of that. And then short-term, all the politics that happened in the last month has pushed usage up. But donations are also coming in pretty well too. A good example, National Honor Society, I think it was 1,500 pounds over Halloween. And then this morning when I came in, there was 390 pounds from a Girl Scout troop that got the food this morning. So we appreciate donations. I'm here with Pam, Lori, and Ted, who've all been at the food shelf working today with me. And then the donations help us quite a bit, because we can purchase low-cost food from North Country Food Bank and get it at quite a bit less cost than if you went to the grocery store and bought it. So if you're thinking of going to the grocery store and then donating to us, we kind of prefer you just give us the funds and we can get it at a much lower cost if you go that way. So, but we keep serving, and thank you very much for thinking of us. Much appreciated. Last year, I think we gave 270 tons of food away. It's like, I calculated it out, it's like 38 school buses of weight, so.
That's a lot of food. And people can just drop by the food shelf if they've got to check later on, if they hear it on the video and stuff like
Definitely.
that. Okay, sounds good. Okay, I'm going to introduce our panel here. We have Deanne Johnson, who is our senior program manager at the Northwest Minnesota Foundation, where she leads initiatives focused on strengthening elder care and supporting the well-being of older adults across the region. With a background in Head Start and substance abuse, Deanne brings a lifelong commitment to a community health, education, and resilience. She collaborates with local organizations, service providers, and policymakers to address the evolving needs of an aging population in Northwest Minnesota. Developing initiatives and sustainable approaches that help older residents age with dignity, connection, and independence in their communities. We also have Connie Carmichael, who is the director at Living at Home of Park Rapids area. I've known Connie for several years. We were trying to figure it out at Action Park Rapids a while ago, somewhere between 8 and 10 years, something like that. And we worked together in several projects on that, one of which was the volunteer website, which now United Way that works out of Bemidji has taken that over, so that was real good. But Connie has been a tireless campaigner for the Senior Citizen Center. I don't know how many grants I've heard that you've written. And helping to coordinate and consolidate services all in one place for our seniors. And she's going to tell us some of the highlights of how that happened and how it's changing some of the things around here. So I will turn it over to Deanne, and then we'll have some questions towards the end.
Okay. Is that on? It's on. I can hear it.
Yeah. Okay, just talk real.
Okay.
Is that loud
Can
enough,
you guys hear me
everybody?
back there? No? Would it help if I just talk really loud? Sometimes it's more effective. Well, I'll let you monkey while you do that. So again, I'm Deanne Johnson. I'm with the Northwest Minnesota Foundation. I'm actually one of the newer employees. I've been there since the end of May. And my bio that I sent her, AI makes me sound really good. So it's really helpful. So when they hired me, the board said, we want to do something in elder care. We have to figure out what that is. So I've spent the last 6 months learning, getting out into community, asking lots of questions. So like she said, this kind of started with the fact that I went to the health fair in town. Tried to take advantage of opportunities like that where all the service providers are in one spot. And I was there for probably about 3 hours, worked my way around the room, and went up and asked everybody, how do you work with seniors? How do you work with the aging population? What are you doing? And just collected as much information as I could about what do you guys do? What are the services that are available? Because when I started, the understanding was there's not enough services out there for seniors. Well, what I found out is the exact opposite. There are services out there for seniors. There are services out there that work with the aging populations, those with disabilities. The problem is there is a gap between you don't know what you don't know. You may not know how to get a referral for somewhere. You might not know what their phone number is. You might not trust them because you don't know them. And it's very interesting to hear the answer to the second question that I ask everybody is, what are your challenges? Where are the gaps? What do you need to become more successful? And that's where we found out where the problem is. We don't know what we don't know. People don't know about our program. I need a referral to get into that organization. Some people didn't even know that services like these exist. So how would I know to ask for them? How would I know to, get the number for, there are people out there that will come into my house and clean my house for me? Oh, that exists in our town? Okay. So that's what I did. And then I worked with an organization called the Dancing Sky Area Agency on Aging. Throughout the state, they call them the AAAs. And they receive funds from the Older Americans Act dollars. And then they work with the service providers in the area to get them the funds they need to run the programs that serve those that are in the older adult and disabled categories, okay? They did a needs assessment for us. I don't know if Park Rapids did, I know you guys have age-friendly money in town for different programs. Did you guys ever do a needs assessment based on their AARP age-friendly framework? Well, that's what we used. And the questions are all about the livability of a community. Okay, so they did a survey for the general public, and they did focus groups throughout our 12-county region, which Hubbard County is a part of. Okay, so we got 309 surveys back, all from throughout the region. Hubbard County, let's see, what was the number of Hubbard? 5% of our results came from Hubbard County. And from that, out of a 1 through 5, they scored Hubbard County as a 3.7 on the livability scale. So that took into account, are there services available? Do you feel welcome in the community? Do you feel safe in the community? Are there any needs that you have in the community? And they got to answer quite a few different questions. And some of the areas that they brought out were the affordable services for yard work or home repairs and affordable home care services are some of the gaps. And this is specific to Hubbard County, not just the entire region. But let's see, it said that for the number of unsure responses, indicated a need for education on available services and healthcare in the area. They had a number of safety and community challenges selected and emergency preparedness concerns. So when we look at that, and I talked to Dancing Sky, one of the things that they found in their focus groups, that's where they sat down with a group like you guys, and they asked the personal questions, and they let people really expound on what their thoughts were around all these areas. And so when people put emergency preparedness, what they found was it wasn't that the community wasn't ready for emergencies. The older population didn't know what the plans were. They didn't feel comfortable with what they were supposed to do, and they didn't know who to ask questions of. So it wasn't that the community wasn't ready, that there was maybe a communication gap. So working on things like that. Okay. So we took all of the results like that from Hubbard County, and we put it all together with all the other counties, and we identified what the highest needs were. And then I put in all the stuff I found out from talking to all the different service providers. And the top recurring themes across the region, these aren't going to shock you: housing, transportation, in-home services, legal services, mental health services, connections, social connections, emergency and disaster planning, safety, flip the page, yep, and safety, okay? So those were the big ones. The one-page sheet that they handed out for you guys, this is what we put together for our board and the focus that we're gonna take. Because at the foundation, we don't do direct services. Our goal is to connect people with resources. Okay, so our goal is collaboration, advocacy, and making sure that programs like Connie's have the funds that they need, that they make the connections that they need so they can more efficiently use the dollars that they have. Okay, so we picked out our two areas, our regional collaboration and networking. Okay, so our early childhood program, our childcare program, that's one of the things that they do is they have a regional networking group for our northwest area of the state. And they're bringing together, they meet quarterly, and they get together and they talk about what are the gaps, what are the things that we need to do, what are the advocacy points that we have to bring to focus. How can we engage people like you guys to help? All right, so we're looking at kind of modeling that and moving that into action. That's one of our first ones that we would really like to do, is to get more people together. We currently are funding one group out of Polk County, and that is all of the aging service providers. And they've been getting together on a monthly basis, 9 months out of the year. They took a break in the summer, and they actually just met this morning. And it's a very passionate group, and they have said, we need more networking, we need to work together, people need to know where the services are. And their discussion this morning was, how do we make a resource guide? Okay, and we talked about a couple of things, and these were brought up in our research over the summer. So we have two kind of very different populations in our older adults. We have those that have embraced the fabulous cell phones, computers, the technology. We have those that have not, that they're just, nope, I haven't needed it for my entire life, so I don't need it now. So this morning, that's what we talked about. How do we have something that can help both populations? And to make sure that they're honored and respected and we get them what they need. Because you don't know what you don't know. I didn't know that that service existed, so thus I would not Google looking for it. So let's figure it out. So we talked quite at length about having a print publication and having a website-based resource guide. Okay, the state actually has a really nice one that they are in the process of, they just moved it to a new website. So they're repopulating all the data in there, so that people that are tech savvy can go and search in there. Okay, so I said, let's leave it in the hands of the state. They're already paying for it. They're gonna maintain it. We can just populate it with all the information we need. And then when we get people that are in an area where they're super close to the edge of two different service areas, it's easier for them to see what's all available. Especially when you look at some of our service providers, they're serving 6, 8 counties, and they're doing all the traveling on their own. We want to make sure that people know what is covered by which program. Okay, so we're hoping that with the networking, we can help out with the gaps in services that need to be provided. In-home and shore services, okay, so that is snow removal, lawn care, housekeeping, or even home care where they come in with a nurse or a CNA and they actually check your blood pressure and they'll help you with your medications and things like that. What we heard from those is there's a lack of people doing the work. Not that there aren't agencies that do it, but so Hubbard County, what's your furthest away small town that maybe may not have as many people to help out those that live there?
I'd say LaPorte.
LaPorte, okay. So for example, we've got places where in Park Rapids, they have plenty of staff to do it. But in LaPorte, it doesn't make sense to send somebody out, drive all the way out there to serve them. And what they've been trying to do is find employees in LaPorte. Well, there aren't any employees in LaPorte that want that job. So how do we kind of combat some of those gaps? That the service provider is there, but they can't quite get to all the people that need the help in their service area.
That we struggle with that with living at home too with our volunteers. So if we have a client in LaPorte, and we never say no, we say we're gonna try. So if we have a client in LaPorte, but the nearest available volunteer is in Park Rapids, and that LaPorte resident needs to come to Park Rapids to the doctor, it's just a much bigger ask because they have to drive from Park Rapids to LaPorte, back to Park Rapids, back to LaPorte, and then back home to Park Rapids. It's not that we have volunteers that aren't willing to do that, because we do. It's just a much bigger ask, and so my volunteer pool gets much smaller. So it's kind of the same with paid help as well. Those organizations need to pay mileage to their staff to do that. And I always hate to say this, but a lot of times it comes down to funding.
Yep. Because now when you take that paid staff and you're gonna try and get reimbursed, whether it's from Medicaid, Medicare, or even private pay, if I were gonna pay somebody to come help me, I don't wanna pay their time to drive to me. I wanna pay the time that they're there in my home helping me, because oftentimes our older adults have a limited income that's set. I have to work within the bounds of this income. So we're trying to balance all of that out. Medicare, Medicaid, and any kind of insurance company doesn't pay the empty load time. Whether that's transporting someone to an appointment, getting a staff out to do services, they don't get reimbursed for that. So we want people to get together and let's figure out, how do we make this work? The state even has Age Friendly Minnesota. They have statewide, they're called action teams. And they've been meeting, some of them on a monthly basis, some of them once every 6 weeks. And they're all talking on topic areas. And one of them is transportation. And we're trying to figure out, how do we solve this problem? Let's get as many of the best minds together and let's figure out, how do we make this work? There's gotta be a way to make this work. We have great people at the table. We have a population that is doing nothing but growing. And what did you say? Hubbard County, the population over 65
Is right now at 26%. And the statewide average is about 17%, a little bit more than 17% is the statewide average. So Hubbard County is already far and above even the statewide average. And by 2030, they're predicting that we're gonna be in that 31 to 33% range, age 65 and up, just for Hubbard County's population alone. Right now, our population is 21,544. So we're talking 5,600 people right now today in Hubbard County are over the age of 65.
Yep, and this area of the state is the first area of the state where the population 65 and older is now larger than the population in public school, K-12.
Wow.
So we're growing. It's not about birth rate at this point, it's about who's already here. And it's, as we go through the next decade, 20 years, it's just going to continue to grow, that population. And what we hear from those in that older adult population is, I want to stay as independent as possible. I want to stay in my home. We found out that that's the cheapest place to live as you age. And if we're going to continue to take care of people, we've got to figure out how to serve people in their homes. And in our area where it's rural, we got to figure out how to do that when we have a distance to cover, because that's not going to change. We are still going to be far. We can't put resources in every small town. So how do we do that? How do we do that? And that's what I've been doing, is asking, how do we do that? So, okay.
I know, you fund programs like Living at Home.
Yes.
Funnel us some more money. I'll make it happen, I promise.
Right. So we want to keep people living in community, whether that's 5 miles out of town, 10 miles out of town, or right in the middle of town. Wherever you know your community is, that's what we're aiming for. Okay, so some of the other networking areas. If you haven't heard of the adult day services, Park Rapids is part of the Lakes area. Lakes area
That's
Day
our
Health.
group, Lakes Area Day Health. They
Yes.
just opened in September.
Yep, and so what I found out from April and the ladies over there is that is one of the most needed services out in the communities. throughout the state. We are underserved in Northwest Minnesota. You guys have got it figured out. That one is definitely a great thing. If you aren't sure what that is for people that may have some disability, some cognitive decline, and they're not quite ready or can't quite afford to go to assisted living or to a nursing home. They have a caregiver at home, but that caregiver needs to work. So that gives them a place to go to during the day where they can build, work on keeping their skills, be social with people that are in the same population as them. The awesome thing I found out is they do transportation to and from, which for some people, that caregiver may not be able to get them to their location and get those services. So
They're doing some intergenerational work. They're in our building. So there's a daycare that comes every Wednesday. She brings about 10 littles every Wednesday for an hour and a half, and they try to interact. It's fairly new. They've been doing it about 5 weeks. It's more about the seniors just watching the kids play. What's really interesting is when you walk in there and observe it, you don't really see the interaction between the kids and the seniors, but once the kids leave, the seniors laugh all afternoon. Did you see what she did or whatever? And it's just so cool to hear and to see. And the goal is once the Meals on Wheels program moves over into our location, the daycare is going to stay longer and actually have lunch at least one day a week with the seniors. So we're really excited about that too.
yes, that's excellent interaction. So, other things, legal assistance. So there are organizations that do go out and they do provide legal services to all populations. What we heard out in community was our older adults have some pretty big decisions to make, and they have some pretty important legal paperwork that has to be taken care of. And they can't do that in 1 hour. Let me ask you some questions and here's your paperwork you need to do. They want one-on-one help. Make sure I've filled this out right. Make sure that I know what the ramifications of it, what does it mean? How is this going to affect me? So that was another one that someone had an awesome idea. We have law schools that are near us. What if we work with the university? Talk to the university in Grand Forks, North Dakota, and say, could you have students that need to practice filling out these kinds of documents? Could we work with that and have the professor review everything? But then they would have that time to work one-on-one, and it maybe wouldn't be $400 an hour for somebody that's on a limited income. Things like that. Those are the kinds of things we want to try and figure out. How do we problem solve this where it's not going to break the bank? We don't have to ask the state or the feds for a ton of money, but when we have all these awesome resources in our region, how do we figure this out? How do we do that? Mental health supports. So when I went to the community fair, what I found out is there are quite a few service providers that are doing mental health supports in our region. The caveat is a lot of them are doing it by telehealth. So we go back to that technology piece. How comfortable is our older generation in using a computer or a cell phone to be able to do that telehealth visit? Okay?
I have a solution.
She does. She does.
We want to put a technology hub into living at home. I don't know where, because I'm almost out of space, honestly. But it's been part of this dream of mine to have this technology hub. And I go to these national conferences every year. And 2 years ago, I believe it was the one in New Orleans, they have all kinds of technology. They have like friendly visitors that are robots, and you just push a button and they have a regular one-on-one conversation with you. There's a device called LEQ. She even has a name. And some of those providers have said that if I build it, they will put their product in for us to test for free. But it's a lot of coordination of effort, and same with what the seniors are. We don't know what we don't know, so we don't know what to ask for. When we moved into our new building, it was the same thing. We don't know what we don't know. We don't know what we're capable of until we can, get our toes in the water and test it out. So we have some really exciting things coming down the pipe, but it all costs money.
It does, it does. And then you guys talked the food shelf,
Yep.
Food security.
Mm-hmm.
That's
Huge.
more and more important every day. The scare the last month with SNAP being cut off. We had the Susie Bolter is the executive director for North Country Food Bank. And she spoke at a couple different meetings I was at. And she was adamant to explain that food shelves, wonderful, but cutting off SNAP is going to tax them to the point where they may break. And she said, for the same money that one food shelf meal creates, we can do 9 SNAP meals. So we really need to be talking with our legislators the importance of SNAP, the importance of maintaining that for those that utilize it.
I just add, we were at a meeting at North Country Food Bank in Fergus Falls earlier this month, I guess it was. There's 460,000 people in Minnesota that get SNAP. She used the 1 and 9, so everything we put out, the SNAP person is getting $9 more through SNAP. So it's very important because we give out once a month to people for call it a week of food. They need a lot more than what a food shelf can do on that piece.
Yep.
And the new legislation that went through cut out about 27,000 people. There was 3 classes of people that got cut out of Minnesota, and I just tried to relate the numbers back to that 21,000 of Hubbard County. I figure that probably put around 150 people in serious change over that.
There's a true story that just happened 2 weeks ago. So in light of, when the government shut down and everything, and people were, worried already before that.
Right.
And then, so we decided that we had people say, can we just bring some food and have it here? If anybody wants it, they can take it. So we have this little thing set up in our entryway. There's just a few things in there that people have brought. There was 2 things of peanut butter in there. And a gentleman that comes into our work at least every single Wednesday for free coffee and donuts. And he helps us organize our books and our puzzles too. And he saw a jar of peanut butter. And he said to one of my staff, he said, "What?" Because we have a sign there that says, "Take what you need, leave what you can," or something like that. He said, "Does that mean I can have a jar of peanut butter?" We're like, "Absolutely, you can have both if you want." He goes, "No, I need one." He was almost in tears because he got a free jar of peanut butter. That just happened 2 weeks ago. It makes me choked up just to think about that he went home and had probably peanut butter toast, right? And didn't have to worry for that one peanut butter toast.
Yeah. So working with, supporting our food shelves, how do we make sure they're sustainable? Things like that, because, it's young families, it's seniors, it's, we have so many people in the world that they're a paycheck away from, being homeless, a paycheck away from not having food to feed their family or to feed themselves. So we just want to make sure that we take care of those resources. And the other one for making sure that we network really well is opportunities for social connections. So we talked about the community center. Potentially, you have your senior activities.
Dude, look at this calendar, it's full.
Yes.
December's calendar.
Yes. So, and I have to say, as I've been out, some communities aren't lucky enough to have it all under one roof. So that, I think, is a huge win for your guys' community. And if we can replicate that throughout the region, it would be wonderful. Because some towns I've gone to, their living at home program is hidden in the back of this building over here, and then their senior center is, well, it's in this other building, but since there's not staff there all the time, it's not open all the time. Some don't have staff that have been there for 11 plus years, that have been in the community. They have somebody that's maybe brand new to the community, doesn't know where all the resources are. At the Age-Friendly Regional Exchange last week, there was a lady from New York Mills. And she said, well, we've got it all figured out. We're in our city hall, the senior center's downstairs, and if they have trouble, they just come on up to me and I tell them where to call. I'm like, how do we replicate you? How do we replicate you? Because that's what some of our communities need. There's some talk about utilizing something called a navigator. Anybody familiar with the senior linkage line, now called the Minnesota Aging Pathways? They just changed their name. The idea is you call and you say, here's what I need. If you're senior, if you're disabled, you call, here's what I need. And they will help point you in the right direction. Now, if you meet some of their guidelines, often their income guidelines, then they can do what's called a care coordination meeting with you. And they can help you figure out and help you apply. But how about those people that don't meet those guidelines? We would love to figure out a way to get community navigators out there. Some programs have something called a community health worker, and they often work in either medical places, housing, have community health workers working in housing programs, and their whole goal is to kind of wrap around that person, that family, help them fill out their paperwork, help them renew all their stuff. If they're getting anything from social services, you do a renewal every year, and you have to verify everything every year. Well, sometimes that blue envelope ends up in the garbage, and I didn't know I had to fill that out, and now I lost my insurance, and now I lost this. But a community health worker, a navigator could potentially help wrap around that person, that family, to make sure they're getting the services that they need. Lots of awesome ideas that are being thrown out from around the region, okay? We talked about transportation, talked about workforce, needing enough people. Our different communities are working with Age-Friendly Minnesota and the AARP, Age-Friendly Framework, to sign up and become an age-friendly community. Right now, Bemidji is just starting up a committee. And there's different things you have to do, but the whole idea is for the community to come together and say, what are the things that are the gaps that this community needs to make us age-friendly? And now when they talk age-friendly, it's not just about older people, it's age-friendly. Thinking about our younger community members, our young families, as well all the way up to our seniors. But it's looking at what do we need to do to make our community cohesive, taking care of everybody, what resources do we have, what resources do we need. And there are dollars you can apply for in grants each year. And every community has done a different project. I want to say Roseau that did, they have bike trails that they put in, or walking trails. So they took their money and they're putting in picnic shelters that are handicap accessible. So, but that's everything from a wheelchair, a walker, and it all came about because one of their senior members of the community said, the trails are great, I can't make it a mile. I need somewhere to sit down. But that goes for the parents walking with the young child in a stroller, and the kid can only make it so long before they need to get out and move. And so they were putting these picnic shelters with seating, the ability to get off the trail, shade, to take care of them. And that's what that community decided they needed to make their community more age-friendly. Others have focused on sidewalk cutouts. Well, having been someone that's been on crutches before, I'm kind of a klutz, so it's happened more than once. It's more than just someone in a wheelchair. It's someone with a stroller. It's someone pushing a cart. It's somebody on crutches, on one of those fabulous knee scooters. You know, whatever, you name it. There's great reasons to have cutouts, you know, where you're trying to get on and off of a sidewalk. And it's a pretty easy thing to do. You gotta talk to the city, of course, you gotta get them on board. You know, there's all sorts of different things you can do. So that's something that we think could be community-based projects that may not have a huge dollar ticket attached to it. And housing, that one's a big one. We don't have the perfect example, but we do have a couple of efforts that we are working on as a foundation, and then others that we're supporting in a couple different communities. So the foundation has a subsidiary called North Star Neighbors, and they have been working on putting up community land trust homes out in a variety of communities. East Grand Forks, Roseau, Red Lake Falls, Thief River Falls. I believe they have some started in Ada and Bemidji. And it is, they're very, very energy efficient homes. They're brand new. If you check out our website, you can learn more about North Star Neighbors. But the goal is to sell them at a much lower price because of how they have the community land trust set up. I'm not super great at explaining it. If you ever want to know more about that, you gotta talk to Corey Bushy. He can tell you all about it. But we have earmarked a couple of those homes to be directed for the aging population. Making sure that they're all one level, that they're all accessible. But that puts someone into a home for a much lower price. For example, he said that a house that they built for $350,000, if you sold it on the regular market, they're selling it to someone for about $175,000. So it's much, so they're getting, I mean, the ones in Thief River Falls, so you know when you buy appliances and they're called energy efficient? Energy Star appliances. These are Energy Star homes. That's how energy efficient they are. So high quality, very beautiful, nice, brand new homes that these people will be able to move into. So we want to earmark a couple of those for the aging population. Another one is all of our homelessness work. What we have found is that homelessness, the aging population, is the fastest growing demographic in our homeless. And yeah, it's kind of scary, but it's really interesting how they're getting there. And it's oftentimes when a partner passes away. And they explained that one instance, it was the husband paid all the bills. And when he passed away, she didn't know how to pay the bills. And she got evicted. Yeah, so, or they get injured. And they end up where they can't go back to their home and they have no one to care for them. Now suddenly they end up at a homeless shelter. And so I talked with the ladies from the Akeley Community Center and I said, well, when it comes to the aging population, what are you seeing? And they said that our biggest struggle is we're getting quite a few in that population that come in. They're diabetic. We had one that came in and they just had a hip replacement. We can't care for them. This is not the appropriate setting for us to take quality health care into our locations. Not all of our places, all of our doorways are accessible. So if they come in and they have to be in a walker or a wheelchair, they're not able to get in and out. So we need help so that we can better serve these people. We need training for our staff. We need more staff if we're going to be caring for people like this. So there's things out there, not that people don't want to serve them, they just want to make sure if we're serving them with respect and with the care that they need. So, let's see, Thief River Falls and Bemidji both got Age-Friendly Minnesota grants to do some housing studies. Bemidji's, they're still waiting for their results to come back. Thief Rivers is very focused on developing a plan to build 55-plus housing. And they went a really interesting route. They brought in a gentleman from the University of Minnesota Extensions, Ben Winchester, and he came in and he explained to the community how 55-plus housing is workforce housing. And I'm like, tell me more, tell me more. And he explained how if you have a family that they raise their kids in their 4 or 5 bedroom house, and then they want to remain in community. I don't want to move to Grand Forks to assisted living. I don't want to move to a bigger town. I want to stay right here in Thief River Falls. Well, I don't have anywhere to go, so I'm going to stay in this 4 or 5 bedroom house, and it's just me, or it's just me and Dad, and we're just going to hang around, and we're just going to shut all the doors, and we're going to live in the main part of the house. And Ben said, he said, we need to have some place for them to go that keeps them in town and in the community, but that's more right-sized for them. One level, a little smaller space, easier for them to take care of. And then their 4 or 5 bedroom house can get moved into by a young family. Somebody trying to move into town to be part of the workforce. So many communities I've talked to, well, I offered a job to somebody and they can't take it because they don't have anywhere to live and they don't have childcare. So 55-plus housing can help out with that workforce housing. So that was an interesting perspective, and they have moved from conversation to where at their last meeting about 2 weeks ago, they actually put up some mock photos of what the housing could look like. So they're excited, they're passionate, their room's been packed every single time they meet. So very exciting work going on out there, and it's all from the people that live here. It's not experts coming in, it's finding our resources in our communities and building on it. So collaboration, super important. And then they did ask me to talk about what you guys can do. Advocacy, advocacy, talk to your legislators, talk to your county commissioners, talk to your city councils, and let them know where we need support. They may not be able to write the checks and hand out the money, but they can help change some of the legislation that causes a lot of the problems with our service providers. So there is a short list here. There are 6 organizations, either in the state or nationally, that have lengthy public policy agendas. If you would like a list, I would be more than willing to send you all the links to their agendas.
Yeah.
So,
Thank you. Yeah. Connie, do you have a few things you'd like to say, and then we'll take some questions, because I think other people here have a few things too, and that we got lots of information there together. Thank you.
sorry.
It would be wonderful if we could solve all of those problems
Right?
in one building or one spot, but we can't. So so at Living at Home, most of you all know of Living at Home. A lot of you are volunteers of Living at Home, so thank you very much for that. If you're looking for volunteer opportunities, come see me, we'll sign you up. But I always like to come to these presentations, sometimes I only have 4 minutes to speak, sometimes I have an hour and a half. I'm only gonna take 4 minutes today, because I kind of interjected.
Absolutely.
But I invite anybody to come and stop by the office and the building and take a tour, and just sit down with us and talk about how you can help. Or maybe you have neighbors, maybe you need some help, maybe you have parents, we're there, we have tons of resources. So we don't just provide volunteer services, although that is our core. We now have senior center, senior connections. This calendar is December's calendar. It's full of opportunity, and we're adding things every day. This is available in print and online. We do in Hubbard County have a Hubbard County resource directory. We do have a dementia friendly resource directory. We maintain lots of lists, snow plowing, lawn care, home care, housing, lots of different things. But like she said, it's all you don't know what you don't know, so you don't know what you need to even ask for. As a senior, we just want you to come in the door and have a cup of coffee with us, and we will walk the journey with you. That's our motto. We want to be along with you on your journey. So I have packets in the back of absolutely everything we do, brochures. I have business cards if you need them or want them. Friday night, the best way to support us is our rib dinner. Last year in June, we sold out of food by 6 o'clock. So come early if you're going to come. I don't know that that'll happen again this year. We serve 411 meals in an hour and a half. So please come, visit us, say hi. It's a wonderful social outing. It's a wonderful meal, and it's all for a great cause. So
When is the rib dinner?
it's this coming Friday. We start serving at 4:30 at the Legion. At the Legion.
Yep. And if you haven't stopped out, it is an amazing space. Especially, I was so impressed with the caregiver closet.
Oh yes, the caregiver
Yeah,
closet.
because I've talked to other organizations that do the same thing, and they literally have a closet. Theirs is a room that is huge.
Yeah, it's
So-
not too much smaller than this room, filled with durable medical equipment. Some of you are volunteers in that space. It's a wonderful space.
Yes.
And just to put it in perspective, in a 3-month time period, the second quarter of this year, no, the third quarter, we're already in the fourth quarter. We served 441 people in a 3-month period, just in the caregiver closet.
Wow.
We served over 1,000 people in Senior Connections, taking advantage of all the different things that we have going on. And it's growing and changing every week and every month. That's up and above our regular clients that seek services, and that's over 400 a year. We have over 100 volunteers that we mobilize. Just point people to us and we'll take it from there.
Yep, definitely a model for us to talk about in the rest of the region, so.
Yeah, it's a marvelous space. I've even got hooked into going and learning how to play Mahjong. Okay. They say it keeps your brain fresh. We'll see. I think right now it's just running me down.
We have a beginner group.
And that's where I'm at, I thought. And they're all willing to help and teach, but it's like too much. Anyway, questions, discussion points from the audience here.
How far does the program for the helping the living at home outreach, like say in miles around Park Rapids?
We serve all of Hubbard County, and then we also serve the communities of Monaga, Osage, Two Inlets. It all is all dependent on volunteer availability, really, truly. And we do have a lot of volunteers. We very rarely ever have to say, I'm sorry, we can't fulfill that request. But it is very rare. The most times that we have to tell people no is if it's a long distance. I only have about 5 volunteers who like to do Fargo, Brainerd, Detroit Lakes, Bemidji. But even then, it's rare that we can't find somebody.
And when you say that, you're talking about picking someone up, driving them to those towns, and
Correct.
bringing them back.
Correct, yeah. And we do have volunteers. We have volunteers in Akeley, we have volunteers in Nevis, we have volunteers in Park Rapids, we even have one up in the Osage and Snellman area. But that's only one up in that area. We have 5 clients in that area, you know what I mean? So sometimes it's a bigger ask. It takes us a little longer to find somebody. And we're not on demand, we are per request. But you can't call me at 8 o'clock in the morning because you have a 10 o'clock doctor's appointment and expect that I'm going to find. Our volunteers are not on call. They're just living their lives. And then when we get a request, so we do, we don't require, but we highly suggest that we have at least 48 hours notice to fill a request. Can we do same day occasionally if it's close to town and it's, yes, and we have done that, but that's not the norm, so.
Any other questions?
Do you work with, like, the social workers in the hospital, for example, for discharge planning? They're aware of all of your services?
Yes, all of the discharge planners have all of our information. We get a lot of referrals from discharge planning. I do feel sometimes there's a little bit of a disconnect for safe discharge. And transportation is huge. We promote pre-planning, what is your backup plan, a lot. Because if you take an ambulance ride to the hospital, because you think you're having a heart attack at 10 o'clock at night, and they release you at 2 o'clock in the morning, the ambulance is not gonna bring you home. What is your backup plan? How are you gonna get home? We know for a fact that people have been known to sit in the lobby, and it's not just Hubbard County Hospital, it's everywhere. They've been known to sit in the lobby in their jammies till 8 o'clock in the morning until a neighbor wakes up. Now we do have a Lyft service or a taxi service in Park Rapids. It's brand new. But for the longest time, we didn't have any choices. And so Living at Home has been trying to figure out how can we help this problem. And it's a tough problem to have. We're working on it, but it's not solved yet. So what we're doing is have a backup plan. What if you take that ambulance ride and you get admitted and you live alone, you get admitted, but you have a dog at home? Who's gonna take care of your dog? You know, the hospital might have your children's that live in the cities or another state, their phone number so that they can notify you or notify them that you're in the hospital, but they're not gonna be able to take care of your dog. You know, so it's those kinds of things that we talk about all the time. Every day we're talking about what is your backup plan. In the very beginning of Deanne's speech, she was talking about communication. We are all about communication. How are people going to know about us if we're not out talking about it? And I'm out talking about it a lot. You guys all have probably heard my spiel more than once. But that's how you know, because you might bring somebody new to a presentation, and we just have to be there for each other. It's neighbor helping neighbor and community. You want to thrive in the community that you love, and we want you here.
They say it takes a village to raise a child.
It takes
a village to get all the way.
Yes, it sure does.
Yep.
Another question?
An interesting observation about your ambulance example of getting taken to the hospital and not home. We think that that's the norm, that's the way things operate. We were recently in a foreign country and had to take an ambulance ride. Guess what? The ambulance showed up at the hospital and it was time for discharge. Took it back to the hotel.
Really?
Wow.
And that was covered. It's
Nice.
interesting, you know, who would have ever thought
What
that an
country?
ambulance ride means
What
both
country?
ways?
Yeah.
So anyway, I have a more particular question. I'm in a situation where I have a 4-bedroom home, kids all have left, so, and I don't want to leave. That was my dream home. I'm going to live and die there. But I also need some chores, cleaning, baby meals, the older I get. What are the chances that a home like mine could be for a single or working couple to live there, go to work, but then have cheap housing and do chores like that?
We have been
Do you
talking
match
about
people
that.
in situations like that?
We're just in the conversations. We've been talking about that. I also had that same thought when I was doing foster care. Wouldn't it be cool for these kids who are aging out of foster care that are fumbling through community to have a place together where they have centralized living, they have like a house mom. I envision the same thing for seniors. Wouldn't that be cool if you could cohabitate with a younger family, if you can handle a younger family, because let's face it, I had my grandkids for 5 days last week and Sunday couldn't come soon enough. However, the idea to me is were we at the meeting last week? Is that where that conversation came up again? It seems like it comes up over and over and over, so I think you need to put that on your list.
Well, it actually is, it is kind of on the list. I need to go back and try and find the website. There is a big community where they have created like an app that's like a dating app where somebody that has a home and has space and maybe could use some companionship or some help in the home with house cleaning or cooking or something like that. And they connect with a college student. And they come and live free of charge, but you have to mow the lawn, and you have to take out the garbage, and those things, so there's support both ways. And I haven't heard if it's successful. There's a few, ability things and background check things
Right.
you gotta work
That's the
through,
thing.
but
There's-
it would be interesting to see if they're being successful in making those connections. Because that would be a great way to allow someone to stay in their home. I tell my husband all the time, you better, while you're still capable, dig a hole in the backyard because that's where you're putting me. I'm not leaving. Yep. But there are many people that's what they want. I want to stay here. This is where all my memories are. This is home.
We have opened up our homes several times over the last few years to people that we hear about. So-and-so has a job. Oh gosh, when the pipeline was going in, there was a crane operator, and his family needed a place to live, and we're like, we've got 3 extra bedrooms. Our kids are all gone. It was the best. It was the summer my dad died, and so it was. And we had animals. We had 2 dogs. And they were able to stay there and keep the home fires burning while I was with my dad. And it was such a blessing to have them in the home. I don't know if you guys remember when Ed, what was his last name? The hiker that hiked the entire Mississippi from New Orleans to Itasca.
Oh.
Ended up in Itasca just a couple of years ago.
I can't think of his last name.
He came and stayed with us for 2 days.
Really?
He wanted a tent in the yard. He just needed a place to put his tent. And I'm like, so I asked my husband who works out of town, I said, do you think this is okay? He's like, well, do you know this guy? I'm like, no. But he hiked the entire Mississippi. And then, so I said, okay, you can stay in my yard. And guess what? It was storming that night, and I let him come in the house, and I still talk to him. That was 2 years ago. I still stay in touch. He's from the Ohio area. He's hiked all over the world. He's the most interesting guy you've ever met. Now, I'm a little bit more trusting than some. You can't do a background check overnight. I was working at the Enterprise. No, it was, no, because I've been here for 11 years.
Yeah.
Anyways, I don't know, but I feel like, as a senior too, it is so easy to be taken advantage of.
Oh, yes.
So if it is working in a community, let's try to replicate what's working there. And you know what? Try 1 and see if it's successful, then try 2 and see if it's successful. Like with our new building, it's like, if we will build it, they will come. I never ever thought in a million years that this blue sky vision that I've had for about 8 years would ever come to fruition while I'm working for living at home. And really, truly, it only became a reality because of the donation of the building and then the state grants that became available to renovate it. But, wow. It, if you build it, they will come, and it is so true.
Any other questions?
Yeah. Deanne, did the elderly talk about scams? The
Oh,
problems with
yes.
having to scam?
Yes,
They did.
that
Okay.
came up very frequently in the focus groups, and that was something they highlighted under safety, was finding ways to do more education. And there are, many of the law enforcement agencies are willing to come out and talk about the scams and how to keep yourself safe and that
We have
kind
2
of
groups
thing.
in Park Rapids now that are doing scam prevention presentations. So the law enforcement and Jill from Victim Services, they have a program. They come at it from a little bit more of a legal standpoint. And then there's another group of us that just started. We've done 2 now. and both of them were actually at Living at Home, 2 different groups, but both of them at Living at Home. And ours is community scams, community fraud prevention, and it's from a banker's perspective and Living at Home senior perspective and real life stories. I was scammed. I'm on this committee and one of the presenters, and I got taken for $70 recently. And so, yes, there.
I know how that happened. I don't want it to happen to me.
You know how it happened? Facebook. Which is one of the retail stores that I love and have ordered many times from, said they had this great clearance sale, and I'm like, I'm there for it. And I ordered $70 worth of t-shirts.
Online.
Well, through this website of what I thought was my favorite store. I paid for it, and then I got the email confirmation. Guess what? It was I don't know what email it came from, but it was not my favorite store. And I called the bank right away. I had to freeze my card. I had to completely get a whole new debit card. Thankfully, it was only $70. Well, that was probably a couple of months ago, and I still don't have my t-shirts. So, yeah.
This may be a very small niche idea, but having been an RV fan for a long time and kind of outgrown it, I'm wondering if there's a use for used RVs as a temporary transition housing solution for, I mean, my RV sits there and I should sell it, but who's going to buy an older used RV? It's still very good working condition. You wouldn't want to stay in the wintertime. But if you got a homeless person come in, you have no place to put them. If you had a few RVs parked in an RV park in their empty lot, say, we have this for you, you can do there for 2 or 3 nights, and we'll get you someplace where you're waiting.
That is a very interesting idea.
It is.
I will take that back to our homeless team. Yes.
I was just wondering if there's been any work on how you develop volunteers. I mean, a lot of the capacity is recently retired, still capable to do things. Have you done anything, maybe another level up from exploring their capacity and how to recruit them and get them involved?
I never recruit volunteers. I promote and do outreach for Living at Home services, and they come to me.
Right.
I think that if it's a program that is worth its salt and is doing fabulous work and have staff that support the volunteers, then people want to be part of that.
Right.
And that's, I did several years ago, we did the Minnesota Council of Nonprofits did a summit at BSU, and I did a volunteer presentation with another gal. I think you graduated with her, Laura Anderson?
Yep.
Yeah.
Yep.
And so her and I developed this training together, and it was like, I'm not calling it volunteer recruitment, because we don't actively recruit volunteers. We want volunteers to walk our journey with us because of the good work. We want the work to represent itself. And I think we are getting younger and younger, earlier retirees that want to volunteer. I think it's really important, like at our rib dinner, we try to get kids involved, you know, those kinds of things, and then their parents are involved as well. So we've had some church groups help us at our rib dinners. I think we just keep working on, there is a certain point where, certain generation where the volunteering is not a priority. You know, they're too busy raising kids, rightfully so, we've all been there. But I think if you start instilling volunteerism young and talk about it, I always say my volunteers truly make the magic happen. And they do. My staff does too, believe me. But I think we just all talk about not just Living at Home's volunteers, but the food shelf volunteers. And I think it also starts with your leaders. And do you have the right people on the right seat on the bus? because if you don't have a good leader of an organization, your volunteers are not gonna come. And a prime example, I won't give you the group, but there's a group that is not even functional in Hubbard County anymore, but they wanted to recruit me so bad to belong to their group. And I did a couple presentations for Living at Home to them, and I walked out of those meetings saying, there is no way I would ever join that group, because it was unorganized, it was nitpicky, you have to allow your leadership or your staff and your volunteers to do the good work.
Must have been a church.
It wasn't. And I would never throw anybody under the bus like that. But I'm just saying that that is how you're gonna build your volunteer base.
And you're not wrong. I've heard from many, many of the organizations I talk to where they struggle to find volunteers. And they specifically said it's because people are working longer because they need the income or they need the benefits. And so their volunteer base is shrinking. Now, I do wonder, we have not heard exactly what it's gonna look like, but within the next year, there's changes coming to Medicaid. And one of those changes is that there is a work or volunteer requirement. What will that look like? I don't know. Will it be where they can come and volunteer at the food shelf? They can volunteer, doing different things in our different organizations in the community. Because if they go to work, there is the potential to lose the benefits they have because there's this
There's such a fine line.
horrible
It's such a fine
thing
line.
called the benefits cliff that, so my previous job, I worked at a community action agency and I was a Head Start director. And one of our goals for Head Start families was that we get you, if you're unemployed, we help you find a job. That whatever your goal is, we help you achieve it. And we had so many of them that went, okay, yeah, I got a job and now I'm doing great things and I got a raise. And now I lost this benefit, and I lost this benefit, and the difference in that raise did not make up for the benefits that I lost. So I do worry what that's gonna do with that change in Medicaid. It's great to get people to work, to feel productive, to be proud of what they're doing and taking care of their family and becoming self-sufficient. But we have to make sure we do it in a way that isn't gonna make them fall off that cliff.
It's gonna be an interesting tracking burden for volunteer organizations
Yes.
to keep track of and sign off on that. And
Yep.
it will do to us.
Yeah,
Yep.
it's
That
gonna be
will-
interesting.
I am happy that we have time, but I hope they get working on what that system looks like before they enact it.
Right.
And not only that, but then they have to think about the transportation in rural Minnesota and rural Park Rapids. Because if you're gonna require, our city proper is only 4,000 people. We have 21,000 people in our county. 5,000, 6,000 of those are seniors. But if they're gonna require, maybe they're a younger, maybe 55, maybe 50, and on Medicaid, and they're gonna require them to volunteer, but they don't drive, either from physical or whatever, how are they gonna get to those volunteer duties? We don't have transportation in rural Park Rapids.
You can fully expect them to roll out a ready, shoot, aim approach.
I
Yeah,
totally agree.
yeah.
Especially when they don't know rural areas like
Right.
this. Because they're looking at the cities. Oh, that's easy, you get on a bus. Here. Well, I'm gonna cut us off here. Because I think eventually they want the bank room back. Thank you, Deanne
Yes, thank you.
and Connie. This has been a great discussion. And I'm sure if you've got a couple of quick comments or something for them while we're cleaning up, it'd be wonderful.
Yeah, it's only 22 minutes past my bedtime, so
Yeah.
I'm going to stay out just a little bit longer.
So thank you once again for coming out today. And if anyone is interested in finding anything more about the League of Women Voters and joining our group, we would love to have you. We also love volunteers. We especially need some tech-savvy volunteers. We're looking for a treasurer's apprentice to learn how to be the treasurer eventually. I mean, the lady we've got doing this has been doing it for 15 years or more. And we figure we need to train somebody, but right now we gotta find somebody with interest, so. We hold Zoom meetings during the winter time, so you don't have to worry about travel. And you can be wherever in warm states you wanna be. But we try to have some sort of informational part and then a business meeting. We're also planning a multimedia program with Detroit Lakes Isaac Walton League, which Willis has put us together with, and that's going to come sometime in the spring, so stay tuned. But talk to any one of us about being a league member. We would love to have you join us. And thank you again.
And I think she's saying there's snacks.
Yes.
Yes, there's lots of cookies and apple cider and coffee. And then we have a donation basket over there for the food shelf as well. So thank you
And
all.
they accept checks, I understand.
Cash.
Cash?
Whether it's folds or jingles.
I was at a 5 angle.